called Deanna, but her name is Dina. And see, there's an A on the end of her name, but it's silent. So how are you doing today, Dina?
I'm fine, thank you.
And this is Donna. I'm going to get her name right. It is Dina. So Donna, tell us, what do you do at Wayne Memorial Hospital?
I am a registered nurse and I work in the cardiopulmonary rehabilitation program.
Mm-hmm.
I am the supervisor of clinical operations for cardiac rehab.
Okay, all right. And Dina?
I'm a respiratory therapist. I work with the pulmonary rehab program.
Okay. Okay, now, a typical day in cardio, I mean, that must be challenging and always life-threatening when you deal with patients in that area. So, what is your? I know there's no typical day. It can't be a typical day.
Right. It does have its challenges, of course.
Mm-hmm.
But on a typical day, we do our cardiac rehab programs in the morning and our pulmonary rehab programs in the afternoon. The cardiac rehab program is for the individuals who have some type of a heart condition.
Mm-hmm.
It can be they are post cardiac bypass surgery,
Mm-hmm.
maybe they've had a heart attack, maybe they have angina, maybe they even have a valve replacement or even a cardiac transplant. Those types of individuals are certainly candidates for the cardiac rehab program.
Okay.
In the pulmonary rehab program, those individuals are people who have some type of a respiratory disorder.
Mm-hmm. Now, Dina, what is a typical day like for you? Is what you do?
I'm in the class. We have two classes in the afternoons,
Uh-huh.
and like she was saying, we see people with some kind of chronic lung disease. It may be COPD, emphysema, bronchiectasis, so just different lung diseases.
Uh-huh.
We exercise because we want to increase their exercise tolerance because these individuals have a hard time doing everyday activities. So if we can increase their exercise tolerance, it'll be easier for them to do those activities.
Oh, okay. So now, when you from your department, as far as a patient, do they pretty much interchange sometimes into her area?
Oh, that can happen, absolutely, because a lot of people who have heart disease also have some type of respiratory disorder.
Mm-hmm.
So an individual can go actually through both programs, not
Mhm.
simultaneously, but
Right,
yes, they
of
can
course.
go through both programs.
Mm-hmm.
But most of the patients that go through the cardiac rehab program are after some type of event, either a heart attack or a stent placement or bypass surgery,
Oh, okay.
that sort of thing.
Now, what is the average? Is there average rehabilitation period for, let's say, after a mild heart attack or?
Well, the program itself is 36 sessions, so that we're with the patient for 12 weeks. It's a major commitment on the patient's part, but we need that kind of time to teach them what they need to know. It is an exercise program, but there's a lot more to it than just exercise.
Mm-hmm.
The education component is very large.
Mhm.
We have a lot of different topics that we cover with them: general education, pulmonary education, as well as nutrition education.
Mhm.
It's a multidisciplinary team that works with these individuals. It's not just coming and riding a bike or
Right.
a treadmill.
Right.
Yeah.
Nutrition, is that?
That's
you incorporated that in?
Yes, we
also?
do. We have a dietitian who is part of our team,
Mhm.
and we also have a social worker who is part of our team.
Oh, okay.
Her role in the program is to help with individuals who may be having some difficulty with anxiety or depression.
Okay.
Oftentimes, whenever an individual is recovering from some type of an event, or
Mhm.
if they are dealing with a chronic health issue or a sudden change in their health status, they go through periods of anxiety and depression. So we want to address that up front.
Oh, okay, great. So now, at the start of the 36-week at the start of the 36-week sessions,
Mhm.
excuse me, walk us through the process once the person is in. What's the first? Oh, yeah, of course, excluding paperwork, because we already know.
Oh, yeah.
We know
of
there's
that.
going to be plenty of
Yes.
paperwork.
Right.
But what can they look forward to at certain benchmarks, and at the end, what is their ultimate goal
Okay.
for you have for them?
Well, an individual who is referred to the cardiac rehab program, they do have to be referred by a physician.
Mhm.
It's not something that you can just sign up for.
Okay.
So once we get the physician referral, I have the individual come in for their initial assessment. During that time, we take a health history, we look at your medical records to explore lab work, things like that. And we do a very simple physical assessment and walk test to see where their actual functional capacity is at that moment.
Okay.
And that's where we start them. So it doesn't really matter how a person comes to us, at what level of exercise they're capable of doing.
Okay.
We start them where they are.
Uh-huh.
And so then after their initial assessment, they are put into an exercise class.